Thanks, Kathy, and thanks to the organizers for including me. Thanks to you all for hanging around and not flying to the airport to catch your flights before the end of the session. No pressure to try to fit in about 3 hours worth of content in less than 30 minutes. We'll do our best. We'll be adaptive. We'll be resilient, and we'll move forward. We've been talking about organizational resilience the whole time here, and as I was listening into a lot of the sessions yesterday, a number of topics came up that really tie into it. I mean, you're talking about well-being, you're talking about stress, you're talking about meaningfulness in people's work, talking about mindfulness, you're talking about a climate that's supportive of employees and the organization, the people who are working there. Talked about self-care. You heard case examples of the variety of ways that organizations handle it. And that's one of the key messages is there is no one pathway to creating a healthy, highly functioning organization where there's resilience. There are a lot of different pathways that'll get you there. And a lot of the success depends on how well you custom tailor that, which really ties into the design thinking, the systems thinking around it, that there's not a cookie cutter approach where you say, here's best practice, everybody follow this recipe, and you'll wind up with this great set of resilient employees in the organization. So applying these concepts of design thinking and systems thinking here, really, it brings it back to a human issue, right? This is people-focused in all the things that we're talking about. And that's where psychology comes into play, because a common thread across all of these issues we're dealing with, whether it's organizational functioning and performance issues, whether it's health and well-being issues, the common thread is human behavior, and that's psychology's area of expertise. So that's part of what we do is work with organizations, employer groups, industry groups around how to create these environments and to apply the knowledge base and research base from psychology to do that. And often what we find is the solid evidence-based programs that you're putting in place are necessary but not sufficient. That yes, you have to have those, but if you ignore the underlying psychological factors along the way, you don't get the outcomes that you could. So you're not using resources as effectively and efficiently as you might. So I'm going to step back for just a second and talk a little bit about the concept of resilience and what that means. You've heard sort of different definitions, different approaches, and that's one of the issues around the concept of resilience, is there's this lack of conceptual clarity around it. In fact, there was a review article done in 2011, and they found, in looking at the literature, there were 104 different definitions of resilience in the literature that they could find during that review. So it's being talked about in different ways as it applies to different populations, whether it's a skill set that people develop, whether it's state versus trait, whether it's the demonstration of the ability to bounce back, whether it includes the concept of growth following adversity, or whether it's just being adaptable to it and being able to continue functioning. So there are all these different ways of looking at it. And one definition that I'm going to put up in particular, which is more tightly defined in the research literature, is resilience is the demonstration of positive adaptation in the face of significant adversity. Now, this poses a challenge for us in organizations, because unless you're looking at military populations, first responder populations, that is very hard to study, and it's very hard to measure in terms of how successful you are in your programs, just because the incidence rate of being exposed to significant adversity in the average work setting is pretty low. So even if you put things in place, you rarely get the opportunity to test out, did it actually work? And even if you do have the opportunity, so if you've got a workforce that is exposed to those kinds of experiences, what you find is it's so variable in terms of how intense it was, the duration of their exposure, what kind of adversity they were exposed to. So it's hard to put those controls in place to know if what you did in this resilience trainings or programs or things that you're doing actually worked. And even when it is measured, it's rarely done longitudinally. So you get, yes, somebody in a 1 month or 3 month follow-up, they were able to return to their normal level of functioning and baseline. But do you know 6 months out, a year out? Do you know its effect on the organization? You're still focused on the individual level. So there are many, many challenges in here, not the least of which is, are you looking to help people buffer themselves from the stressors they face, so that they never have a decrement in actual functioning and performance if exposed to these kinds of stressors? Or are you trying to prepare them so when they bounce back from a decrement? And there's no single answer to that. You have to decide within your own work, your own industries, your own organizations, how you're defining it, because that's going to affect the kinds of initiatives that you put in place and how you approach it. So that significant adversity piece is really challenging. In the average organization, we're really just talking about exposure to day-to-day average low-level work stressors for the most part. There are elements that could be in there. You heard some examples talking about hostile work environments, harassment, bullying. There are some occasions where that type of thing happens, where the exposure it is more intense, is more extreme. But in most organizations and for most of the workforce, you're talking about their daily exposure to work stressors. You're talking about quantitative overload, qualitative underload. You're talking about lack of clarity around roles, expectations in organizations, conflict interpersonally. So you're not typically talking about these extremes. So for the purposes of the rest of the talk, and as you're thinking about it in your discussions in a minute, I want you to use a definition that is, I'm going to use McEwen's definition, which is defining resilience. It's not this one, which is better for research, but practically speaking, McEwen defines it as capacity to manage the everyday stress of work while remaining healthy, being able to rebound and learn from unexpected setbacks, and being able to prepare for future challenges proactively, so you're ready. You can see why that's a mess if you're trying to research it, because there are a bunch of different things folded into that. But practically speaking, in an organization, you really need those elements that people can manage what's thrown at them on a daily basis, that they can bounce back when they do have that adversity, and that they can be ready and move forward and be successful in an organization. So for the most part, we're talking a lot about stress in organization, really. And when in our program at the American Psychological Association, we do surveys of the U.S. workforce. So we measure attitudes, opinions, work experience for the U.S. workforce representative sample. And so one of the things that we looked at was resilience that we looked at a couple years ago. And we used the brief resilience scale, which is actually measuring that narrower definition of people's ability to recover from stress, to bounce back when they face the stress. And if you focus in really on this bottom part right here, I mean, what you see is you've got about between 15 and 20% of people who say that they have a hard time bouncing back. It takes them a while to get back to normal. So even though that's a relatively small percentage in the organization, you have to think beyond the individual for the impact on the team, the impact on the organization. So even though you're not looking at 75, 85% of people, that's a large enough portion that it's having an impact not only on their functioning, their well-being, their job performance, but everyone else on their team, and in turn, the rest of the organization. So there is a need there, even though it's not one that might jump out at you. When you take a closer look at what's being done in terms of mental health and stress management resources, all of this is a shared responsibility between the individual and the organization. We put most of our emphasis typically on the individual, but as was mentioned earlier, that's sort of letting the systems get off easy, right? And if you don't have access to the resources, if you don't have the supportive psychosocial environment and the benefits and programs in place, then the expectation that individuals should just be able to weather that is not only realistic, but it does a disservice to the individuals as well. You're trying to pile a bunch of armor on them and then throw them back into an environment where they're going to get beaten up over and over and over. So it's not going to be effective, and most of the time it's a colossal waste of resources if you're not addressing the other systems level issue. So if you look at these slides up here, you can see that less than half of working Americans said that their employer provided the resources necessary for them to meet their mental health needs. Only about 4 in 10 employees said the organization provided the resources that employees needed to manage the stress that they faced on a daily basis. And more than a third of the U.S. workforce said they experienced chronic work stress. Their daily experience on the job is they're stressed out. That's a pretty significant chunk of the working population to face that kind of stressor on a day-to-day basis. So there's a big need there. As I mentioned, most organizations spend all of their resources on that individual level. They do stress management trainings and brown bags and all of those. which are great. You do need to do that. People need to build the capacities and the individual resources to cope with it. But in the absence of the organization sharing responsibility, it's not going to be effective. So there are actually individual/organizational level interventions that bring together employees into special interest groups, work groups. It pairs people off to actually work together on it. And then the bigger picture, which actually can have the greatest impact, is organizational level interventions. Everything from aligning your hiring and selection practices so you have a good fit between the people coming in who have the resources and skills and capabilities to handle what is going to be common in that organization, to providing enough autonomy and control in the workplace, to providing a predictable work environment as much as you can. In health environments, that's sometimes very difficult to do. But these big organizational factors that go beyond, I'm going to prepare you to be able to withstand what we're going to throw at you. We're going to create an environment that's going to support you. We're going to give you the resources that you need to be able to do that, and we're going to do this together. So it really is a shared responsibility. Talk for a minute about organizational culture, and that's come up in a number of the talks here. Yeah, and I think it's a really good metaphor because you can think about what you put into the dish, right? But it's not just what you put in; it's the environmental conditions around it. So it's the temperature, it's where you actually have it, it's anything that actually got introduced into it inadvertently that might grow in there. There are a lot of things that work really well with the metaphor, but the organizational culture and climate has a lot to do with how successful these efforts are and how well employees can handle stress and their resilience to be able to move forward productively, be healthy, have high levels of well-being, and perform well for the organization. So I'm going to talk about a few of the psychological factors that underlie this. And this is what I mean, that if you're not addressing these things, then the resources you're putting into those programs and those benefits and those efforts are falling short. What we find are these huge spreads in terms of these psychological factors. So this breakdown on this slide, for example, this is U.S. workforce as a whole, and it's whether people feel treated fairly by their employer or not. So these are organizational justice issues. And the green bars are people who say they feel treated fairly by their employer, and the red bars are people who say they do not feel treated fairly by their employer. Look at the difference in terms of motivation to do their best for their employer. 89% versus 40%. Job satisfaction, 92 versus 19%. These are gulfs between these outcomes. So when employees are feeling like they're not treated fairly in an organization, their job performance is suffering. Word of mouth in terms of reputation of the organization is likely to suffer. Chronic work stress, look at this, 31% versus 70%. People who don't feel treated fairly, 7 out of 10 say they experience chronic work stress versus less than a third when they feel treated fairly. They're more cynical and negative during the workday, which affects the team, affects the organization, and they're more likely to say they intend to leave the organization within the next year. You see the same kind of split in trust. Do you trust your employer? Same kind of split, motivation, job satisfaction, relationships with supervisors, chronic work stress. Again, look at that difference. 23% if you say you trust your employer versus 70% chronic stress if you say you don't trust your employer. Big differences here. So this matters in terms of the well-being of the workforce, and it matters in terms of the performance and success of the organization. Whether you feel valued, so this gets at the recognition component that it's come up in a couple of discussions. Are people rewarded, recognized, commensurate with what they're contributing to the organization? Do they feel like that's done fairly? Don't get lost in these millions of stats that are up here. But if you look at here's the chronic stress down here at the bottom. And again, it's 29 versus 69% if people feel like that they feel valued by their employer in the organization. So a lot of this has to do with the culture and climate of the organization, not just the programs and practices and policies that you have in place. So it really is more this organizational level issue. And the only point I want to mention off of this one is we did a measure of well-being climate, and we adapted a measure that was of safety climate for a well-being climate to look at it, and only 44% of working Americans would characterize their organization as having a climate that supported well-being. And one of the truisms that we hear all the time is senior leadership support is important, right? Any of these efforts you're talking about, you've likely heard it said just as a truth, that senior leaders have to be behind it, they have to be walking the talk, they have to be out there modeling the behavior. That's come up as well. And we hear it all the time, and so we thought, well, I've never seen data that actually demonstrate it, so we wanted to measure it and see, is that actually true? So we looked at the difference between when people said that their senior leaders supported the climate of well-being, which includes resistance to stress, resilience, and overall well-being, compared to those who said the senior leaders were not supportive in the climate. And look at the breakdowns here, all the way down to whether or not employees actually participate in the programs that are available. So we know that employees need to be involved and engaged and actively part of that. But when senior managers support well-being in the organization, 73% of employees say that, yes, they actively participate in these involvement efforts, versus 22% when senior leaders aren't supportive of well-being. That spans whether they think the organization actually cares about their health and well-being, whether they participate in the health and wellness kinds of activities that are offered in the organization, to relationships with coworkers and supervisors, down to those organizational indicators like motivation and satisfaction and turnover intent and so on. So yes, indeed, the truism that's said by everyone under the sun pans out when we look at the U.S. workforce in terms of the data. It says, yes, when people say their senior leaders are supportive of this actively, that the outcomes look better across the board. This is our psychologically healthy workplace model from the American Psychological Association, and you can see that it's not about individual programs or policies. It's about the collection of activities that you're engaged in, and yes, the health promotion and wellness and safety efforts are part of that, which is what we typically think about when we think about resilience and stress management and well-being in general. But it's not just those programs, it's how they interact with growth and development opportunities, opportunities to be involved in meaningful ways in the organization, work-life balance and flexibility, the reward and recognition mechanisms that are in place, and good communication practices. And when all of that happens collectively, it enhances employee well-being and organizational functioning and performance together, which in turn reinforce each other. When there's higher level of well-being in the organization, they perform better. The organization does better. And you heard that at the very beginning yesterday, talking about patient outcomes, patient experience, workforce turnover, costs, all of those things. And similarly, organizational functioning, when people are in a better functioning organization, a healthier organization, is better for their health and well-being as well. I'm not going to get into this element, but I will tell you on our website, which is apaexcellence.org, which is the Center for Organizational Excellence website, we have all our reports from the surveys that we do. And one of the things we looked at recently was organizational change efforts, because that's part of resilience, being able to cope with and manage change, which we know is increasing in organizations. There's more people are put in situations of working with teams that are constantly shifting. The rate of change is moving faster. The communication technologies that keep us moving at light speed and can intrude into our lives. So we looked at whether organizational change affected employee and organizational outcomes. And yes, indeed, if people had recently or are currently experiencing organizational change, then that was linked to more physical health symptoms at work, feeling more cynical and negative. They ate more. They were more likely to smoke during the workday. They felt like there was more work-life conflict that was going on. So the interesting thing is that it was most pronounced when there was current or recent organizational change efforts, but simply the anticipation of organizational change, that things were coming down the pike, that also had an effect, which was in between. So that even if it's not happening, if they're thinking that it's coming, that's affecting outcomes as well. And in terms of employee experience, that affected their satisfaction, feeling valued, treated fairly, those psychological factors that are so important as well. So I'm going to leave this one up here while we move to the activities before we get to the question, because this is a model, and this is based on more of the adversity model, but you can apply a lot of this to organizations. And what I want to point out in this model here is if you're only focusing on the individual, you're only looking at this piece here, which is the capacity for resilience in the individual, and these little individual resources here, that all these things at the bottom that are in the resources, these are the things that influence capacity for resilience in a workforce. So if you're only focusing here and here, you're missing all of these other contributing factors, because organizational resources, family resources, community resources, all of these things affect capacity for resilience. And so as you're thinking and you go into this discussion, I don't want you just to think about, what program or benefit or policy could be slapped into place to improve resilience in the organization, because that might affect those little pockets. You can affect bigger change sometimes by figuring out what organizational resources could you put into place? How can you support family resources? Because including dependents and partners and spouses has a big effect on how people cope in and outside of the workplace. And how do you link to community as well? Because our organizations and the people we work with are embedded in communities. And healthy communities are going to support your workforce as well, give them the senses of connectedness that's going to contribute to that social support. So I'll leave that there for the move into the group discussion.
Thank you.